Yes. Rebecca, thank you for coming to Turkey. Rebecca, nearly 1 in 3 cats worldwide suffers from kidney disease. Do you think this condition is hereditary? What do you think?
Well, I think there probably are genetic risk factors that increase the chance that any particular cat is going to develop kidney disease. But we see this condition across all breeds of cat.
Yeah.
And every breed is at increased risk as they get older. So I'm not sure I would describe it as a hereditary condition, more as something that all cats are at risk for.
Yeah.
And it's partly going to be their genes, and it's partly going to be what they're fed, and it's partly going to be other risk factors that they come across as they age that contribute to them developing the condition.
Yeah, perfect. Thank you for in kidney disease, which stage is considered life threatening for cats?
So the interesting thing about when we diagnose cats with chronic kidney disease is that some of them then progress very quickly, and others stay very stable and die of something else when they're older. For the ones that progress, it's really once they reach stage 4 in the iris staging system that their survival time is going to be pretty short at that point. So stage 4 is the point at which the kidney disease is likely to be the reason for euthanasia or the cause of the cat dying. But, you know, half of cats will never reach that stage and will actually stay in stage 2 or earlier stages.
Yeah, interesting one. How should elderly and cautionary kidney disease cats be managed? What are the main risks to this?
So the main thing we can do that we know will improve survival time is to feed the cats on a kidney diet or a renal diet. We have a number of studies that show us that cats will live longer if we feed them on a kidney diet. So that tends to be a protein and phosphate restricted diet. But there are lots of other things that we need to think about when we're managing these patients. We need to check whether they have high blood pressure. And if they do, we need to treat that, because otherwise that can be a big risk factor for blindness, for further damage to the kidney, the heart, the brain.
Yeah.
We should check if the patients have proteinuria. Cats with significant proteinuria don't live as long as cats without, so we need to treat the proteinuria if that's present. And then we need to look at any other supportive medications that individual patient might need. So some cats might need potassium supplementation. Some cats get dehydrated quite frequently and might need to have fluid therapy or subcutaneous fluids at home. Some cats suffer a lot with constipation and might need medications or laxatives to help with that. So it's about looking at the individual patient and which treatments might help that patient. Yeah.
Secondary, this is an interesting question. Which secondary disease can be triggered by kidney disease? More this important secondary.
Yeah. So the most obvious answer to that question is hypertension, because the hypertension is a direct result of kidney disease in most of these patients. And overall, about 60% of cats with kidney disease will have hypertension. So that is the main condition that is caused by kidney disease or happens secondary to the kidney disease. I think a lot of the other things that we see as concurrent diseases in our cats with kidney disease, it's not that they're caused by the kidney disease, it's just that they complicate our management of these patients. So for example, cardiomyopathy.
Yeah.
It's not caused usually by the kidney disease. Sometimes there can be contributing factors, but often it's a case of the cat has developed both of these conditions, and then the difficulty is managing two conditions that can be at conflict with each other sometimes with their treatment.
Thank you. Are the risk for kidney stones the same as for chronic kidney disease? What are the main complications of kidney stones?
So this is quite an interesting area, I think.
Yes.
We tend to see two slightly different groups that have kidney stones. One is the group of cats that have chronic kidney disease, and they are at risk of nephrocalcinosis, so mineralization within the kidney, and they can have kidney stones associated with that. But we also see kidney stones in much younger cats that don't yet have chronic kidney disease, although those cats are at risk for the stones moving into the ureter, causing obstruction, and then kidney disease developing secondary to that obstruction because of the significant damage and acute kidney injury that occurs. But I very much think that in these younger cats, the kidney stones come first, and then it triggers the chronic kidney disease.
As young cats or old cats, which one more important for chronic?
For chronic kidney disease, old cats. The prevalence of chronic kidney disease increases as cats get older. So by the time we look at a population of cats that are 15 years or older, 81% of them have chronic kidney disease. So if a cat lives that long, they're pretty much guaranteed to have chronic kidney disease. And when there was a big study performed in the United Kingdom, where they found that renal disorders of one type or another were the biggest cause of death for cats over 5. So it becomes more and more prevalent as cats get older.
So last question is Klivet Congress. How is the Klivet Congress going so far? Are you happy to be here?
Yes, absolutely. The Congress has been wonderful. Yeah, it's been really good.
1,000 veterinarians come here.
We've had lots of great questions. People seem to enjoy the lectures. There was an amazing band last night with great Turkish music that I very much enjoyed. It was great.
Thank you for yesterday, the presentation, very energetic presentation. Thank you for coming again. Thank you very much, Rebecca.
Thank you so much. Thank you.
Thank you.